as achondroplasia. Michael has known he was different since before he was 5 years old.
It wasn't like a secret that I was going to be short of somebody else, but it became more apparent that it was going to be more significant to other people as I got older. Picture?
Today, at age 38, Dr. Michael Lane is an orthopedic surgeon at Johns Hopkins in Baltimore, one of the nation's leading medical centers. By any measurement, he is a success. So, this is the story of a little guy from Long Island who made it big, becoming a reluctant role model along the way.
You're as good as new. You want to stand up and walk for me?
For the last 4 years, Dr. Michael Lane has been here at the Johns Hopkins Children's Center, seeing patients suffering the full spectrum of bone-related problems, from simple fractures to club feet and to very complex conditions like curvature of the spine. Nurse coordinator Maria Papa says he has a special rapport with his patients.
He's very comfortable with himself, and that makes people he works with and the patient he ministers to very comfortable with him.
You say ministers to. That's an unusual word to describe a doctor.
There's a different kind of glow when I see Michael with his patients. It's almost like someone's ministering to the sick.
Michael's height does not interfere with his work here. The clinic did make a few adjustments. In the hallway where busy doctors and nurses grab charts, one counter is built in at the typical height. Another counter is set a few feet lower. In the exam rooms Michael uses, the X-ray view boxes were lowered so he can use them without asking for help.
I always thought that if I worked hard enough, I could get it. I might have to work harder than the next guy, but I could still achieve it. Thanks for coming. I appreciate it.
Looking at the easy way he interacts with patients, it is hard to believe that Michael came very close to missing the chance to become a doctor. It was his first real setback in life, and he did not see it coming. He was a top graduate of Brown University, one of the nation's most prestigious universities, where he excelled in both academics and athletics. Michael expected his Brown degree to be all he would need in order to gain access to the first step of his dream to become a physician. He applied to 20 medical schools. He told every one of them that he was a dwarf, and every one of them rejected him.
I was devastated. I remember the first person was down at University of Pennsylvania, and he said, you know, we're not going to take somebody who's short. No way. I just looked at him. I was like, and he said, well, patients are going to want a doctor that they respect and that they can look up to. And how are they going to hold, you know, be respectful of you? Or he actually said that. Yeah, and this was 16 years ago. And I remember vividly, I mean, I remember what he looked like, what he was wearing, what I was wearing. I mean, because it was such a bad time in my life.
A year later, Michael reapplied, but once again, the rejection letters started coming in. Finally, one school decided to take a chance on him. It was this school, Albany Medical College here in Albany, New York. It happens to be the same school that took a chance on me back in the 1960s when I applied after completing seminary and working as a minister. At that time, I was 29 years old, considered to be too old by most medical schools. But Albany gambled on me and on Michael Lane by giving us both a chance to become doctors.
First day or two, I was sitting up front because I wanted to do well. I really...
Right down there.
Oh, yeah, right where that guy is.
We recently visited the Albany campus together. He reminisced about his medical student days.
But I remember coming here every day, the same room. And next year, it's the same room on a different level, right?
Michael wanted to become a surgeon, but he faced yet another round of rejections after graduating from medical school in 1989. Once again, Albany gave him a chance. He won one of the 4 slots in the residency program for orthopedic surgery. Michael was one of 400 applicants. Dr. Richard Jacobs was chief of the orthopedic surgery department at the time.
I thought, why not? He'd be judged along with all the rest of them, and it wouldn't count against him in being short or tall or indifferent. If he was bright enough, he was ours.
Ow.
Michael worked around the physical obstacles to his residency program. He needed operating gowns that fit, so he convinced the nurses to cut them down to size.
There you go.
Perfect.
Okay.
You haven't forgotten.
No.
And he had to do the intense scrubbing required by surgeons before surgery. Michael showed me how he got around that problem.
So what I would do is just put that right on the corner there, And then I just moved that over, and now I got my scrub sink, and I'm high enough so I don't make a mess. I'd be able to wash my hands thoroughly.
You're done, just stick the
And when I was done, I just go like this, and then
voila.
done. And then hopefully to operate.
Yeah, great. Albany also provided Michael an opportunity to meet someone very special.
So this is the place, the VA hospital, where you met your wife.
Yes.
Was it ever an issue for you, obviously, that he was short?
No, never. It was more an issue for him, probably, than for me.
Is that right?
Yeah. I was like, you know, like, does she really know what it means to be dating somebody or living with somebody or married to somebody who is short?
Valerie convinced him that she did understand. They married 4 years ago. With a new wife by his side, Michael decided to specialize in the severe bone conditions that most often affect dwarfs. It was a profound decision for Michael, who had never wanted to call attention to himself in that way.
When you push this way toward the car, push.
Push.
Oh.
His decision is even more meaningful now, since his 2-year-old daughter, Alexa, was born with dwarfism.
Good job.
Michael's practice includes adults and normal-sized children, but a growing number of his patients are children of short stature. Parents travel great distances to bring their children to him.
I love seeing the kids. I like talking to the parents. I have no problem. You know, I'm an achondroplast who's an orthopedic surgeon who's trying to do a good job. If you have short legs, which I have, you can't sit in a chair properly.
Michael often volunteers in the diagnostic clinic sponsored by the Little People of America, as seen in this documentary. It was at a Little People annual meeting that young Evan Morehouse, now 7 years old, first spotted Michael.
I thought he was a dwarf, but I did think that he was like a real man.
What made you think he was a real man?
By the way that he looked.
How did he look?
He looked really handsome.
Evan's parents, Tracy and Steve, were so impressed with Dr. Ain that they commuted from their home in Vermont so that he could perform the needed surgery on her hips to help correct her bowed legs. And for the Morehouses, the fact that Dr. Ain himself was an orthopedic surgeon and a person of short stature gave him an insight other doctors did not have.
I think that the way that Evan is going to develop and the way that another average-sized child is going to develop are completely polar opposites.
On the day of surgery, Evan's dad is with her in the OR as final preparations are underway.
Yep, I think she's looking good. If you want to give her a kiss right there on the shoulder, she's doing just great. Take very good care of her. You can pull your mask down if you want.
I'd do anything to not have this operation happen, but we're in great hands, and that's a relief in itself.
You can appreciate Michael Ain's achievement all the more when you know that he is only one of 3 physicians in the country who are dwarfs and the only surgeon. And he's an orthopedic surgeon, which requires a lot of brute strength and skill. Evan's operation involves several hours of drilling and nailing, typical of bone surgery. Because Evan is so small, Dr. Ain has to modify the steel plate before inserting it into her hip. During the operation, he is constantly moving up and down the steps, all the while wielding the medieval-looking tools of his trade.
Okay, you can let go, Maurice?
He is in his element, relaxed and confident. The people who said he didn't look like a surgeon have simply been proven wrong. His chief is Dr. Paul Sponzeller.
I was thinking, well, is there anything Michael can't do? And the only thing I could think of was that he has trouble, reaching to adjust the lights in the operating room, which you have to be pretty tall for. So you can get somebody to do that. But really doing the surgery, there's nothing that I'm aware of that he can't do.
Now, the future is especially bright for the Long Island kid with the moxie, the brains, and the incredible determination.
You look back on those doctors who said you couldn't be in medical school, that you couldn't be a surgeon, that even when you got in, that you would never make a surgeon. Tell me the truth. Have you ever been tempted to write him a little letter or send him an article? Huh?
Oh, sure. You're tempted. But then I say, why waste my breath? Why waste my time? I mean, I know what I've accomplished, and I know hopefully what I will still want to accomplish. And, forget about that. They're not worth it. How's every day?
And those who are worth it, those who know him really well, say you quickly forget Michael Ain is a dwarf, but you never forget him.
I still kid him. We talk on the phone every now and then. Every time I talk to him, I say, "Are you famous yet?" He's going to be famous. Trust me, he's going to be famous.
Dr. Ain, you deserve to be famous, and maybe tonight will help. Well, Dr. Tim Johnson, Dr. Ain's colleague and friend, is here. And Tim, is this condition very common?
The best estimate is about 1 in 10,000 births, so there are thousands of people who have various forms of dwarfism, and many of them are hearing about Dr. Ain and coming to him for care, and he right now is kind of wrestling with the professional question of whether or not he's going to devote his entire medical work to the care of dwarfs rather than also general orthopedics, and I think he's leaning in that direction. He feels very called to it, and he's very good at it, and they obviously identify with him.
And he sure understands it. Well, you know, Tim, we tend to literally look down on these people and dismiss them as being short in intelligence, which, of course, is not at all the case. They deserve the respect and the understanding, and maybe Dr. Ain's example will help.
Oh, I hope so.
I hope so. Thank you for bringing us this report. We'll have more in a moment.